Alright, guys. So we spoke of a lot about some nerve compressions. We spoke about trigeminal nerve neuralgia. We spoke about glossopharyngeal nerve neuralgia. A lot of nerve compressions, right? And we said that most of these nerve compressions they could result into several problems, right? So there's a surgery which is done to actually what decompress it. Can you see that here? There's something they put between the blood vessel and the nerve. That's what is a pad, right? So like they cushion it so that it will not compress the nerve. You get? So this is what is known as a microvascular decompression surgery. Right? So it's a surgery done to like stop the compression of nerves. Right? So micro decompression surgery is a surgical procedure used to treat conditions caused by what? Vascular compression of cranial nerves like trigeminal neuralgia, glossopharyngeal neuralgia, hemifacial spasms. Right? So there's a disease condition coming in because maybe there's compression on the nerve, you understand? So the goal of this microvascular decompression is to relieve the pain and muscle spasms, okay, by moving the offending blood vessel that is compressing the nerve, right, and placing a small pad, okay, that's the pad I was telling you guys about. So they place a small pad between the blood vessel and that was compressing the nerve and the nerve, right, so that it will not be compressing the nerve again, right. So for the procedure, we see that it's pre-operative test for MRIs, brain wave, what, just to confirm where the problem is, right? Surgery is done under general anesthesia. So the surgeon makes a small incision behind the ear on the affected side, right? Uh, Decompression. So using a microscope, the surgeon moves the blood vessel away from the nerve and places the pad between them to set them apart, all right? Okay, microscope or just using any surgical tool, right? So that's just it, right? So related conditions could be trigeminal neuralgia, where there's severe pain, right? When you try to touch your face or when you try to chew, when you are eating or when you talk, right? And all of this is because there's a compression to the trigeminal nerve. Glossopharyngeal neuralgia is pain in the throat. So in this procedure, I was saying you cut it at the ear. So this ear is just for the trigeminal, right? So glossopharyngeal, you know that is somewhere, well, it's still around the ear or tongue, right? But depending on where the pain is, because there could be nerve compression in different parts of the body. This one, so I was trying to talk about what the most commonly compressed nerves, right? There could be even nerve compression in the lower limbs. You understand? So also is indicated for what hemifacial paralysis or spasm, right? Facial paralysis or spasms. So for risks and complication, infection. There's a risk of infection at the injection at the incision site. Bleeding. Bleeding is common, but excessive bleeding may require additional treatment. So sometimes it can cause hearing loss, sometimes it can cause facial weakness again. Right. So that's just it for what? Microvascular decompression. I see. Alright. You put a pad in between the blood vessel that was actually compressing this nerve. Yeah. Microvascular decompression surgery.